Hey everyone, welcome to our podcast, No Stupid Questions. I'm Dr. Kim Bissell, the Southern Progress Endowed Professor in Magazine Journalism and the Associate Dean for Research in the College of Communication and Information Sciences at the University of Alabama.
And I'm Dr. Annalisa Bowen, an Assistant Professor in the Department of Communication Studies, also at the University of Alabama. And we both work in the Institute for Communication and Information Research, or the ICIR, at UA.
Right now, in 2020, there's a lot going on. We're in a global pandemic. This pandemic is impacting everything. It even affects the way that we're sharing information. We used to spotlight our faculty using newsletters that would be physically put into mailboxes. You know, those days when we were walking down the hallway and slipping a newsletter into our colleagues' mailboxes. Well, we're not doing that right now, but we still wanted to get the word out about research that's going on in the College of Communication and Information Sciences. We started thinking about how we could tell the stories about research in a way that could be shared with an even broader audience.
Yeah, so with that in mind, I have a question. Have you been watching a lot of TV right now? I really have. I've watched a lot of TV on a lot of different platforms. Netflix, Hulu, Amazon Prime, regular cable. It's out there. I'm watching it. But that's got me thinking, do you think that characters are portrayed accurately in TV and film? I'm thinking about characters who might be experiencing depression or anxiety, or other mental health challenges. And how are we as viewers able to tell whether these portrayals are accurate? Is that a stupid question?
That is not a stupid question. And that's one of the reasons we're really excited to be talking to Dr. Scott Parrott today. Before getting into academia, Scott worked as a reporter and a journalist for newspapers in North Carolina and Alabama. And it was his experiences as a journalist that have driven some of the questions he asks in his research.
So Scott's doing a ton of research about a lot of different things, but it all comes back to communication and his experiences, like Kim said, that have driven the questions that he asks in research. He explores mental health in the media. He examines prejudice and whether video games can be effective in reducing that prejudice. He even explores how suicidal ideation and death by suicide are covered in the media, and more.
So we had a really great conversation with Scott, and we think you're going to enjoy what you have. So welcome, Scott Parrott. Of course, we are thrilled.
All right, first, Scott, can you give us an elevator pitch on your research?
Yeah, sure. So as Kim was saying, research broadly media and mental health. There's a couple of different angles there. The first is look at the representations in the media of different mental illnesses, just to better understand how movies and news stories and magazine articles and things like that represent different mental illnesses, and then how exposure to those messages might shape our attitudes and our emotions and our behaviors related to mental health. And then the other angle of my research actually has to do with how media exposure affects symptoms of mental health, such as depression.
So you're a former journalist, and so I'm thinking this should be pretty easy for you. If you had to come up with a headline for one of your most interesting findings, what would it be?
I think one of my most interesting findings would be computer games reduce prejudice. I did a study once where we designed an interactive narrative, and so it's a story that puts the user or the player in the place. I would say user in the place of in this case of an immigrant, and it asks the user to sort of navigate a day in the life of an immigrant in the United States. And we found that when people were exposed to this game, when people were permitted to sort of interact with this narrative and immerse themselves in the shoes of another human being, that on the back end, it actually had some good effects on their attitudes toward immigrants and reduced prejudice.
So can you elaborate a little bit on that and tell us how you came up with this idea of having your participants kind of be a user in this game format?
Yeah, so a lot of the research in media stereotypes, which is my area broadly, has focused on the negative. And so traditionally, it's focused on how different social groups are represented in the media and then sort of the negative impact of those stereotypes that people encounter. But there's a growing interest in how the media might actually be used for positive means to actually change and improve people's attitudes and improve relations between social groups. And so this actually came about in relation to a journalism project. I had some friends who were working on a project in North Carolina about sort of the real life stories, the human interest stories of immigrants who are trying to cross into the United States. And so one of the things that they did was actually develop this interactive narrative. And so when I saw it, I just thought, I wonder if that actually does have some sort of effect. I wonder if, digitally walking a mile in the shoes of someone else can actually increase your empathy and have a positive outcome in terms of prejudice, in terms of reducing prejudice. And so they let us use the game, and then some colleagues and I conducted this experiment where we exposed people to the game or not, and then we compared their different emotional and attitude reactions to it. And so we found that the evidence that we found was that it does seem to work. And so the implications of this is that a lot of people are playing games now, whether it's video games, computer games, games on your phone, and so there's a whole area of research and sort of social activism, advocacy that is designing games to essentially teach people about important social issues, but then also to lead to pro-social outcomes related to things like poverty, stereotypes, prejudice, things along those lines.
That's a really fascinating study. That's something I didn't even know that you had done that before. That's fascinating.
So when you're thinking about this type of research, who are your participants? Are they children, college students, kind of adults?
Yeah, I'm mostly interested in young adults. We have it's sort of the research question, I guess, guides who we're looking at, but for the most part, it's young adults. And the reason I'm really interested in young adults is because once you're in your 20s, late teens, early 20s, you really start to see sort of the onset of a lot of different mental illnesses. Like that's when it, I guess, really starts to, you start to see symptoms, and you start to see like an indication that someone might be experiencing something that could be with them for, potentially the rest of their lives. And so I think it's a really important age at which to reach people using the media and other means, and to encourage them to talk about mental health, talk about mental illness, and to pursue treatment if they need it.
Can I go back to one of your areas, and you mentioned how mental illness is represented in movies.
Yeah.
Can you give us maybe a movie where mental illness is well represented?
Yeah. So the one that is most often pointed to as just like a great example is A Beautiful Mind, which is a biopic, a movie about the great mathematician and Nobel Prize winner, John Nash. And it's the movie that has Russell Crowe in it. And so John Nash had schizophrenia. And so the reason that movie is, I guess, considered by most people to be a decent representation of schizophrenia is that it shows both the highs and the lows. And so it's a portrait of a human that has some nuance. Whereas like the negative portrayals, if you watch a show like Criminal Minds, for example, I looked at the first season of Criminal Minds, which is a police procedural kind of detective show that is quite popular. And we looked at the first season of that, and I think out of a dozen episodes, 4 of the episodes had a character with schizophrenia who went on some sort of violent murder spree. And so that is an example of like a terrible and stereotypical and prejudice-inducing media representation of schizophrenia.
So to follow up on that, Scott, and this can be just more sort of anecdotal or observational or based on the research that you've done, as we as a society have talked more about mental health, especially with different populations, it seems to me that we've seen kind of an increase in that representation in a mediated context, and you mentioned Criminal Minds. So have you seen an increase of characters dealing with different mental health issues in the shows that you watch, or is it something you've heard about? And do you think that we gradually are getting to a point where mental health is discussed or covered in a more positive way? I know the Criminal Minds representation was not that, but what's your sense of kind of the media landscape now?
So when you asked me for a headline earlier, I was going to focus on this, but then I couldn't figure out a way to summarize it in 5 words, so I bailed on it. So the really interesting thing I found recently was that back in the 1950s, George Gerbner, who's really big in our field for developing cultivation theory, when he was just first starting out, he did a study about television censors in Hollywood and how they handled content related to mental illness. And so this was, 1950s, and he's finding the same thing. He found that television censors constantly had to, weigh questions as to whether they should permit TV shows to use mental illness as an easy plot device or as a simple explanation for behavior that is, otherwise unexplainable. And so, I mean, it's been around for years, like 70 years. We've seen these representations in the media, in not only movies and television shows, but also in the news. The one thing I would say, though, is that things seem to be improving. And so it's a great time to be looking at this and to see this, because, I mean, there's still like studies in Canada and the UK and the USA that show there are still stereotypes that abound, such as this association between mental illness and violence. But the thing we're starting to see is that more and more often journalists are starting to actually interview people who are affected by mental illness, which leads to, humanizing portrait. And you're starting to see more feature stories, more human interest stories, rather than stories that focus simply on crime. And so the criticism that's been out there for 70 years is that journalists and Hollywood tend to focus on this association between mental illness and violent, unpredictable behavior, which is false. It's an inaccurate stereotype. But it seems that the programs that have been designed to train Hollywood and to train journalists are maybe having some sort of effect, and there's probably some sort of cultural change happening too that is leading to differences in coverage. But essentially, we're seeing more positive. Still a lot of negative, but more positive nowadays.
So, Scott, I know some of the work that you've done has focused on representations of veterans and mental health. Can you tell us a little bit about some of those studies?
Yeah, so we have a veterans and media lab here in the College of Communication and Information Sciences with some doctoral students, and then myself and a colleague in the School of Social Work, David Albright. And so one of the things that I think is interesting about this area is that since the draft ended back in the 1970s, fewer people are serving in the armed forces in the United States. And so military service tends to be sort of, I don't want to say confined to the family. That's a poor word for it. But essentially, if people who served in the military didn't have children who serve in the military. And so it's sort of basically what's happening is the general public, fewer people are serving, fewer people have direct connections, is what I'm trying to say. And so when you think about it, that leaves a gap in which the media can step in and become an important source of information about what it means to be a veteran and what it means to serve in the military. And so we've started to study media messages about military veterans just to see what sort of information is put out there to the public. And it's interesting. And the reason it's interesting to me is just because there are so many stories out there about veterans, whether it's Hollywood or television or the news, but they're so limited in scope. There's no nuance to them from what we're seeing. And so these are things that have been pointed out by veterans organizations and veterans as problematic, and they include positive stereotypes such as all veterans are heroes, and it could be a negative stereotype, which is all veterans have a mental illness. It's really complex. It's a really complex issue. It's a really difficult issue, but it's something that we're doing more and more work in, and so we find it really interesting.
Again, that's really fascinating, Scott, and I think that it's really bringing to light very, very important issues related to not only the way the media cover and handle the topic of mental health and mental illness in a news and entertainment context, but the effects that type of content can have on viewers.
Yeah, and so that's one of the things that we're moving toward and we're interested in, is that when a military service member returns from service and reintegrates into the community support and the community treatment of that person is very important. And so if there's a lot of misunderstanding, or if there's this gap in understanding and knowledge about what it actually means to serve in the military, and there's this misperception about what it means to be a veteran, it could potentially lead to some issues and some misunderstanding. And so right now we're studying the content, and we also recently conducted a national survey where we're looking at people's attitudes and mental representations of veterans and how that might be affected by the media.
Mm-hmm. So how do you take this information that you're finding in your research and get it out to the public or to journalists or to Hollywood? How does that happen?
So that's really where the research is leading right now for me, because you don't want to be stuck in the ivory tower with no actual real world impact. Mm-hmm. And so the one thing that we're trying to do is connect with counseling centers, mental health centers, mental health advocacy organizations, veterans organizations, things like that, and developing training programs for media professionals, and then interventions for different populations. And so really just trying to get out there and affect some sort of change.
Is that something also that just for any students that are out there listening, that they can expect to get in the classes that you teach or that others in our college teach?
Yeah, definitely. Both for undergrads and grad students. Like for undergrads, I actually taught a class in the summertime about media and mental illness, where we looked at the different representations of mental illness in the media. And then we ended on a positive note where the students, over the course of the semester, developed a project that would essentially work as an intervention to try to change some of the negative representations and try to correct some of the misinformation. And then in terms of the graduate level, we have an outstanding faculty who are very diverse in terms of like their methodological approaches and theoretical approaches in their subject matter as well. And they can basically introduce a student to all sorts of different methods for answering questions that they might be interested in.
Mm.
So, I mean, you're a journalism professor and you work with, budding journalists and reporters. When you get them in the classroom and you're talking about these issues, is it something that you feel they've already kind of come into the classroom with these stereotypes and sort of stigma associated with things like mental health, or are you getting them as kind of a blank slate?
I'd say they come in with it, but I think it's actually the opposite of what you would expect. I see a lot of hope, and I hate to sound like an old man, but I see a lot of hope.
Hope is good.
I hate to sound like an old man because it's like I see a lot of hope in the young generation, essentially. But I really do. Like I think attitudes are starting to really change, and so what I've encountered in the classroom is sort of like a breath of fresh air. It almost seems like when I start to talk about this sort of subject matter and material, it's more like students are breathing fresh. They're just saying, "Oh, thank you. I've been waiting to hear that." It's like internally they've always felt the same way, but they just haven't spoken about it in any sort of setting. And so there's usually great dialogue, and I think they have a better grasp on what it means to actually have a mental illness than some of our older generations do, in my opinion.
Well, Do you feel that that's because on a sort of societal level, it's something that we're talking about?
Yeah,
And
I
I
think
know
it's,
this,
yeah, I think
you
that's,
know,
I mean, that's one of the things we're looking at too is more and more. Yeah, that's like one of the goals is for us to talk about it and just to challenge stigma just by talking about things. And one of the things that you're seeing right now, and one of the things I'm studying with Andy Billings uh, in relation to sports communication, is the role of professional athletes and other celebrities in changing attitudes toward mental health. And what we're finding is very promising in that regard as well, because essentially people look up to athletes in particular in this country. And so when an athlete like Kevin Love, who is a professional basketball star, who's another professional basketball star, when they come out and they say, listen, I've experienced depression, I've experienced anxiety, they can serve as an excellent role model for others. And so we've done some research. Actually, one study we recently concluded looked at how social media responded to those disclosures. And we found that it actually led more people to disclose and say, you know what, I'm going through the same thing and I'm going to seek some treatment myself. And I applaud you, sir. So.
that actually makes sense to me though, because I feel like it's difficult, especially for college students or even, younger adolescents, to be sort of the first one to make an announcement. This is what I'm struggling with. I'm dealing with depression. But if they can kind of, follow on the heels of a celebrity or an athlete, then it sort of normalizes it a little bit.
Yeah.
I think it makes it a little less scary.
Yeah, it challenges a lot of the traditional stereotypes. Like Kevin Love, you would never know. And one of the stereotypes out there about mental illness is that it limits what you can do with your life. I mean, it certainly can present challenges, and it certainly can limit, but it doesn't necessarily have to. And so you look at professional athletes, professional musicians, people you look up to, and they can serve, as an inspiration. That says basically like, look, they go through the same thing, and look how they do. And then at the same time, the good thing about DeMar and Kevin Love is that I think they give a more nuanced representation where they embody like the highs and the lows.
Certainly, that makes a lot of sense.
Yeah.
So you've mentioned sports and veterans. And along with that, some of the colleagues that you have worked with. Are there any other fields or any other collaborators where your research has led you to?
Yeah, definitely. I think one of the great things I'm seeing in my opinion, I'm seeing a sort of a sea change in terms of collaboration where the field is becoming more interdisciplinary. And so I'm working with people in psychology, computer science, business, marketing, social work, and everybody's bringing in sort of their area of expertise to the team. And then it gives us an opportunity to really explore some interesting questions. And so for example, like in terms of the computer science and marketing folks in social work, we've been working on projects related to social media and discussions concerning suicide in relation to military veterans in the United States. And so we've been working on a series of projects in that regard, and we have some interesting stuff coming down the pipe, I guess.
So when you look at sort of the body of work that you've done and that you have up to this point, for all of the budding researchers out there listening to this, what are your recommendations or suggestions for future research? What are the things that we should be looking at in future studies down the road?
My first bit of research would just be read. And then the second one would be to assume that someone has always done something and then try to build off it, because essentially it's you can have an idea, it might have been done, but then you can always build off the idea. And so just assuming that it's out there, go try to find it, see what it has been done, and then build off it. And so in regards to our field, there have actually been calls, and I agree with those calls, that the problems associated with media and mental health in terms of like the representations of mental illness are very well documented, because like I said, it's been 70 years worth of research that have produced consistent findings. And so it's time to, in my opinion, move on from that and see what positive outcomes can come from media exposure. So how can the media be used to improve mental health? How can the media be used to, or how can the media improve their representations of mental health? So that's what I would focus on.
Those are great suggestions. Shifting gears just a little bit, can you tell us how this pandemic has potentially, or not at all, affected your research, just in terms of the way that you work with participants and the move to home and all of that?
You know, one thing it's done, I think, in my general area of research is I think there's a lot more interest in it, to be honest, like public interest in it, because I think a lot of people are experiencing things like anxiety and depression in some form or fashion right now, just because of the uncertainty of the world and, you know, the sort of the threats that are out there. In terms of my own work, I'm finding that I'm much more focused, because when I have time to do research, I have time to do research. And so if I want to get it done, I have to focus. And so there's less wasted time. So it's actually, you know, it's making me focus, and it hasn't changed it really otherwise.
Yeah, that's something that we talked about last week just a little bit, how when we're in the offices and we're working with people just down the hallway, it's really fun to interact with people and talk to people and have quick conversations in the hallway. But what it can do sometimes is interrupt that flow, whether it's, you know, thinking about something or writing. I have found that, you know, having an uninterrupted hour is difficult when I'm in the office, but working from home, it's a little bit easier to get into the zone. So
yeah, I'm longing for those interrupted
exactly. Yeah. I think at the beginning I was like, this is great, I'm so productive, and then maybe 2 months in, I thought, I'm very lonely, I miss everyone.
Yes. So, Scott, I think our last question might be, we'll shift gears a little bit more, but as academics, we have the good fortune of being able to travel to different countries or different cities around the U.S. for conferences. What is one of the favorite places that you have visited or traveled when you have presented research?
Oh, it's tough. I'd have to say London, probably. We had International Communication Association conference in London in 2013, and that was pretty awesome.
Is there any place that you're looking forward to visiting, perhaps in the future, to present some research?
You know, I'm looking forward to, AJ has a upcoming meeting in Detroit, Michigan, and I am actually looking forward to going to Detroit. I've never been.
That's great.
It's a great American city.
Yeah.
Scott, we want to thank you so much for your time today, and thank you for sharing with us a little bit about your research and all the things that you have going on in your academic life. So thank you for your time today.
Thank
you. We look forward to chatting with our next guest a week from today.
Thanks, Scott.
Thank you.
Thanks. Bye.
Bye-bye.
Thank you so much for joining us for our No Stupid Questions podcast. It was great to have you with us this week, and we certainly hope you enjoyed our conversation with Dr. Scott Parrott. Next week, we talk with Dr. Heather Carmack, a researcher in the area of health communication. Each new episode will launch on Mondays at 11 a.m. Central Time. And if you are feeling up to it, please don't hesitate to give us a 5-star rating so other listeners can find this podcast as well. See you next week.